Okay, I keep seeing people say childhood vaccines were never tested in long-term placebo-controlled trials. Like, no real saline placebo. Is that actually true?
Yeah, I've seen that claim going around. It sounds like what it's stirring up is this fear that vaccines weren't tested as carefully as people assume.
Exactly, like if they skipped placebo trials, that feels like a huge red flag.
Totally. If that were true, it would be really concerning. And honestly, it's a really fair question. Wanting to know how something was tested, especially for babies, makes complete sense. What part feels most unsettling to you? Is it the idea that they didn't compare against saline? Or the bigger worry that long-term safety wasn't studied?
Both. I always thought placebo meant salt water, like with other drugs.
It often does. Would it be okay if I shared what I've learned about how vaccine trials actually handle placebos?
Please.
So placebo just means a comparison group, and sometimes it is saline. A lot of vaccines were tested that way, including measles, rubella, HPV, polio, Tdap, and COVID vaccines. But here's the part people miss. Sometimes researchers use what's called an active control instead of saline. That means they compare the new vaccine to an older vaccine that's already known to be safe and effective.
Why wouldn't they just always use saline?
That's a really reasonable question. The main reason is ethics. If we already have a vaccine that prevents a serious disease, it can be wrong to give some babies a saline placebo and leave them totally unprotected. For example, when the newer pneumococcal vaccine was tested, they compared it to the older version, because using saline would have meant some kids had no protection against dangerous infections. So it's not no testing, it's testing in a way that doesn't put children at unnecessary risk.
Okay, that actually makes more sense.
Yeah, the trials are designed to answer two things. Does it work? And is it safe? While still protecting the people in the study. And then safety monitoring continues for years afterward, across millions of real-world doses.
I also saw something about the hepatitis B vaccine only being tested for like 5 days.
I've seen that too, and it sounds scary out of context. Want to know what that 5 days actually refers to?
Yes.
That number comes from vaccine package inserts, and it was about tracking mild injection site reactions, like sore arms. Serious outcomes were followed for much longer, weeks and months, and the vaccine was tested on thousands of people before being recommended for infants. And hepatitis B can be really serious in babies. It can lead to lifelong infection and liver cancer later. So early protection matters.
Wow. The posts make it sound so different.
Totally. Social media turns complicated study design into, they never tested it, which just isn't accurate. I'm really glad you asked though. If you want, I can send a simple breakdown from Voices for Vaccines that explains placebo testing without all the spin.
Yeah, I'd appreciate that. Thanks.
Of course, anytime.